Can we take our seats? If you could find your place to sit. If everyone could find a seat, please. Slowly. Okay. Wow. Well, what a great crowd. Thank you all very much for being here. I want to get started because we have a very full program, and I want to make sure we have everybody's questions. Everybody has an opportunity who wants to ask a question. So if you could find your seats, stragglers. Are you all not finding seats? Huh. Okay. Yeah. Well, if you have an empty seat at your table, please raise your hand. There's an empty seat over here. And we probably need another table. Yeah, right. So one of the speakers just said, if you want to sit up here, that's okay. They're setting up another table for you. I'm really sorry, but it's thrilling. As the president of Tiger Bay, hi, I'm Judy Sedgman. I want to tell you what a thrill it is to see such a big crowd turning out for a very important conversation. So before we start our program, I'd like to say, first of all, hello, Tiger Bay. Oh, and please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. A little bit of housekeeping to mention. Today's program has to do with the referendum on June 18th. There are two issues on that ballot. We're only discussing one of them today because for one thing, we really couldn't fit two issues into one meeting. The second issue has to do with ad valorem tax issues for Manatee County, with allowing our county to have the ability to be on parity with the counties that surround us in terms of our tax treatment of business. There are a number of people in our audience who are prepared to discuss this issue with you if you have questions about it, if you haven't heard about it, if you don't understand it. Sharon Hillstrom, who is the executive of the EDC, is of course here, but Sharon, if everyone here who's part of the effort to get that issue passed would please raise your hand so people can see who you are. There's a bunch of them all gathered over here. At the end of the meeting, if that is an issue that you feel you'd like to know more about, please search some of these people out and chat with them. And they also have plenty of information to share with you. I in no way want to suggest that that is not as important as the sales tax issue for healthcare, it just isn't as controversial. And as Sharon said, it's kind of a no-brainer if you want to look at economic development in a competitive sense. So we're here today to discuss the other issue on the ballot. It's a very short ballot. So if you've never seen this ballot, it's going to be really easy to vote. There's only 2 little things to read. But June 18th is an odd time to have an election, so you have to get it on your mind and make your plan and put it on your calendar to go vote, or to absentee vote if you can't. But this is one of those moments in time when an odd little special election has critical implications for the future of our county, both in both counts, in both issues. And we thought it was really important, those of us who listen to the conversations that are going on around, especially the sales tax issue, one of the most important things, the role that Tiger Bay plays for our community, is to bring things to the forefront in civil, reasonable discussions that are fact-based. And this is the most important aspect of this issue. There's a lot of misinformation going on around it, and then there are the facts. And so we have 3 speakers, and the first one is going to be Cliff Walters, who needs no introduction. I think anybody that doesn't know Cliff hasn't really lived here for very long, but Cliff is an attorney. And Cliff is, I've known Cliff for a really long time, and the one thing I will say about Cliff is that he's clear, he's concise, he knows what he's talking about, and he can explain things simply. So Cliff's role, he's not advocating, he has no position to take on this. Cliff's role is to just tell you what this is. What are the facts? Then we have, not yet. I'm going to introduce the other 2 before you, that's okay. So, and I'll just go ahead and tell you who the other 2 speakers are and the order in which they'll speak, and then they can just proceed. I also want to mention one thing and I'm going to say it again, when we get to the question period, there's a lot of people here, I'm sure there are a lot of questions. Tiger Bay rules, you must be a member of Tiger Bay to ask a question. If your firm is a member, a corporate member, you are a member if you're here representing your firm. When you get up to the microphone, you say your name and you say, I am a member of Tiger Bay. We also, another Tiger Bay rule, which is a sort of rule of civility, is there is not speech making from the audience. If you have a question, please just ask your question. But, you know, it really impedes the ability for us to get a lot of questions asked and answered if someone gets up and starts making a big preamble to the question. So try to think through your question before you go up to the mic. So I'll give you a chance while the speakers are speaking. You may want to jot your questions down. So our other 2 speakers, the speaker after Cliff will be Dr. Scott Clulow, who is the president of the Manatee County Medical Society. Is a doctor who's just actually moved from a group into private practice in Manatee County. Many people here know him very well. Scott is an advocate for the 5-cent sales tax, 5%, I'm sorry. And so he's going to speak after Cliff. The next speaker will be Dr. Richard Connard. Dr. Richard Connard has informed me, and by the way, whom also everybody probably knows, he's been a doctor in this community since I can remember, and an entrepreneur, a healthcare entrepreneur, been very involved with the Manatee school system and has made many contributions over the years to our community's success and well-being. Dr. Connard informed me that I don't want you to say I'm speaking against anything, I'm speaking for something. And we'll see what it is. So, with that, we'll start with Cliff. I am timing them.
Good afternoon. I may be one of the few people here that really would prefer to be having a drink with Mitch McConnell from Kentucky, but clear and concise in healthcare is kind of I don't know how you get there. It reminded me, in my first year of law school, a professor asked a student to stand, and upon standing asked the student if he had reviewed the material, and the student said, "I have not reviewed the material, but I am prepared to discuss it." Well, by the way, the professor, in telling him to sit down, said, "You will make a fine attorney." I feel, I was not that student, but I feel somewhat akin to that student. And in fact, in going through the internet and reading newspapers and trying to figure out how to communicate on this topic to you all, I'm convinced that virtually no one has a complete and total picture of the healthcare situation and the context in which we're trying to make decisions. So I went to one of my favorite national columnists, David Brooks, who wrote a column on this topic last week. And David Brooks, in his column, recited that he had gone and created a panel of experts on both sides of the issues for Affordable Health Care Act, against it. And he said the overwhelming conclusion is the Affordable Health Care Act will be implemented over the next several years, regardless of how the elections come out. However, it will take at least another election cycle for clarity to begin to manifest itself. It will take a lot of disarray and continued cloudiness around the topic. So how does a local community such as Manatee County deal in this context? Well, let me give, and by the way, I'm not trying to be precise in all of my numbers and statistics. I'm trying to be generally correct. And to the extent I say something you disagree with, it's quite likely I have it wrong, but that means someone gave me the wrong information, because I tried to be an aggregate compilator of our community and sharing some thoughts with you. Around 1984, Manatee Memorial Hospital was sold, and at that time it was losing money in 7 figures. The money from the sale went into a health care fund that Manatee County administered and has served this community extraordinarily well over the past 25, 30 years. The fund itself will be depleted in the next year or two. These funds enabled the county not to have to do what our surrounding counties did, which was impose a sales tax or a form of a property tax in order to deal with the indigent care circumstances. But the time now has come, we're now in a situation where the $9 million or so a year they're spending out of that fund is going to be gone. What many of you may not fully appreciate is the county actually spends about $24 million a year for what you all would generally consider to be indigency type of care, or poor folks, or whatever. And when we talk about the $9 million that's being expended, people forget about the other segment of that, and that creates confusion. To help put it in context, 1 out of 5 of people that live in Manatee County do not have health care insurance. Now, they may be working people, but their employers don't provide health care insurance. There are children that need health care. There are people that are in accidents on our roads that need health care. And the hospitals, by law, if you show up on their doorstep, they have to take care of you. They're obligated, as long as they accept Medicare patients, they have to accept you, regardless of your ability to pay. The problem for the hospitals is they can't provide that care without doctors. So doctors, if you're going to be on the staff, are generally required to provide health care to everyone regardless of ability to pay. Well, think about it. If you're a doctor, are you going to come to this community and be a member of the hospital if half your time you're not being paid for the work you do? So in order to have a healthy and vibrant community, in order to have people here that are not with employers that are providing health care coverage, we've got to have those folks here, and we have to have health care for them. Well, the problem with that is the place where many of them get their health care is the hospital. They don't have a private care physician, so the most expensive form of health care is going in the emergency room. So over the years, Manatee County has developed some diversion practices that have crisis intervention. Much of that's done at Manatee Glens. OBGYN, Manatee Rural Health, has been a godsend to providing prenatal care and services for women that are pregnant. The AIDS crisis, Pat Glass did one of the most politically courageous things I can ever remember by saying this community is not going to ignore this, we're going to be proactive, and she was instrumental and led the county in providing care for people that were afflicted with AIDS. So let's get back to that 26 million, because that's the numbers. 9 million of that, which comes from this Manatee Memorial Health Care Fund, a big portion of that goes to the hospitals and to doctors to provide that coverage. Now, some of you may say, well, doesn't Medicaid take care of that? Well, first of all, Medicaid only takes care of a limited number of indigent or poor people, and it's at its best. But Florida, seeking to well, I don't want to get into political, but we're at the bottom of the rung on providing Medicaid coverage to poor folks. That means our community is backdoored into paying for the disparity between what the Medicaid covers and what the private pay option. $6 million of that $24 million goes to take care of the prisoners. The sheriff, maybe he's got a few out there he would just as soon not take care of, but we've got to take care of our prisoners. Regardless, many of them haven't even been convicted. These are people who are awaiting trial. But regardless of whether you're a prisoner that has been convicted or you're awaiting trial, if you have health care needs, they must be taken care of. And it is not an option, it's a mandatory provision that we have to do. Another 5 or 6 million is a Medicaid match. A big portion of that goes for long-term health care for people that are in nursing homes that have no money. It's mandatory. We don't have an option. We've got to pay for it. Finally, there's another 2 or 3 million that goes to crisis intervention. Do you realize that between the age of 18 and 26 is our largest component of people that have crisis intervention, prescription drug problems, mental breakdowns, drug dependency, alcohol? The image that it's a 60-year-old war vet living in the bushes is not an accurate presentation of our crisis. So, as we look at this, and we go down to the sales tax is designed to generate about 24 million. The amount of money that either your property tax or the current indigency fund that's getting ready to expire covers. So when the indigency fund goes away, the county is going to have to find $9 million to cover it. Now you can take it out of property taxes, which means you either reduce services elsewhere or you reallocate to the sales tax. So it's very much how do you pay for it. My conclusions are that the Affordable Health Care Act, some of you call it Obamacare, is going to do very little to assist this community in addressing the health care needs and our shortfall. My second conclusion is, even if the state had adopted Governor Scott's proposal, which is apparently rejected, it would have had a relatively nominal impact on the 24 million we have to come up with. Third, we have a history in this county of being proactive, starting with the hospital sale, of not waiting until the crisis overcomes us to try to get out in front of a problem and to try to address it in a proactive way with community dialogue, with transparency. And so waiting for the state and feds to solve our problem, I think, is short-sighted. I don't think they're going to solve it anyway. So I applaud our political leadership for the courage of presenting this as an option for us to debate and to consider as we move forward on how do we pay for this 24 million to take care of the health care needs of our indigency and poor in the community. Thank you very much.
before Dr. Clulo speaks, what I'd like to do is read you the ballot statement, because I misspoke about I want to make sure this is absolutely correct. Shall Manatee County levy a countywide 1/2 cent sales surtax for a 10-year period commencing January 1st, 2014. The proceeds of the sales surtax shall be used to fund health care services for Manatee County residents, including elderly persons and children who are indigent or medically poor. Such services shall include primary and preventive care by physicians, clinics, hospitals, mental health centers, and alternative delivery sites in a cost-effective manner. So it's a 1/2 cent tax to do all of that. So now, Dr. Clulo.
Thank you, Judy. Thank you, Tiger Bay, for welcoming me here. My name is Dr. Scott Clulo. Some of you know me. I came to town, Manatee County, in 2002 and was employed by Pinnacle Medical Group at that time. And I just recently formed my solo practice, Manatee Family Physicians, in tribute to some of the first physicians I worked for when I came to town, which was Dr. Blackwood, Dr. Holsworth, Dr. Domino, and Dr. Chin, and Dr. Blackwood, thank you. And of course, Dr. Conrad was part of that group at one time before I came to town. I'm also the president of the Manatee County Medical Society currently, and past president of We Care Manatee. And I just was asked to give my point of view on the discussion we're having today. I just want to preface it by, Cliff had mentioned about Manatee County and being proactive, and I think Manatee County is on that forefront. A number of years ago, I think it was 2008, a study was commissioned. No, it was 2007. A study was commissioned by the Center for Research in Healthcare Systems and Policy and the Institute for Public Policy and Leadership at USF. At that time, the formalized report was released. A lot of us have read that report. They had a number of recommendations, 5, which are all initiated. One is establishing a Manatee County Healthcare Alliance, which took leaders from business, hospital, healthcare providers, county government, health insurance providers, in order to help solve some of the problems we're having in Manatee County. Also develop initiatives to recruit and retain physicians, which is becoming increasingly more of a problem, whether that's loan forgiveness, impact fees, reducing malpractice costs. We have the development of a residency program in conjunction with LECOM and Manatee Memorial Hospital, hopefully to retain some of those physicians who are being trained in our community. Development of wellness and education programs to help reduce the demand on the healthcare providers, especially the emergency room, as well as improve availability of healthcare information to optimize coordination and effective delivery of our resources, which has already been implemented through the Gulf Coast Health Information Exchange, which is a local HIE managed here by local providers. Unfortunately, as you heard from Cliff, today Manatee County is daunted by the depletion of its healthcare trust fund, created in 1984 when the county sold the county-owned hospital. We are expected to see this fund depleted by 2015. The fund is utilized to help pay for medical and mental health services for Manatee County residents who cannot afford health insurance. But as healthcare costs continue to rise, and we have an increased demand for healthcare services by our working poor, or underinsured, or uninsured, we're having a problem funding our current monies. The county is looking to replace that fund, as you know, with a 1/2 cent sales tax. At the same time, the county is also proposing property tax reductions for the county and city residents. I think that as a physician who I'm told is bucking the trend in a time when physicians are forming larger groups and being acquired by hospitals and other organizations, I'm making that attempt to go solo in conjunction with Max Health, and hopefully find some of those ways to help provide services for patients who need that care. Because unless we take care of those patients, we're not going to have a community that's going to have healthy workers to help our businesses employ those working people. And I'm hoping to answer some questions if people have regarding what those issues are for physicians in town, because I want to let Dr. Conrad get his talk in. Okay. Thank you very much.
You
Yep,
have
I'm
some
done.
time if you
I'm
need
done.
it. Okay. Dr. Connor? Ooh, be careful.
Just take the coat off.
Uh-oh.
Comes time to do business, you know, you gotta be comfortable. Well, good afternoon. I'm really here today to do two things, and that is to tell you we've got good news in that we don't have a crisis. And the other good news is we're going to continue to work on it. We're going to effectively work solutions out concerning our indigent medical health. And I'd like to develop those two themes for you, if I may. I came to town in 1967, and when I did, less than a month later, I was approached by a public health nurse that says, we've got a problem with indigent care in our county. This was Mrs. Rose. She had an idea. She says, if I could get some of you guys to work with me, I'm going to do what we're going to call the Red Card Program. The Red Card Program was that she would triage, and if she felt she saw somebody who needed care, she'd give them a red card and say, you go to this doctor. We would see them that same day. We took care of them. There was no charge whatsoever, and we ministered for their needs as hard as we would for the guy that came in the door with a wheelbarrow full of money. Well, I think Cliff said it very well when he said, we're a community that when we identify a problem or a challenge, we come together, we put our collective shoulders together, and we solve that. I'm absolutely convinced we'll do that again with this healthcare issue that we're talking about. And what I'm saying is that we've got very, very creative, energetic, talented leadership in this county, and we don't set up lines of battle to solve our problems. Well, let's talk about this challenge that we've got before us. And I think what I want to do is try to share with you the reality of Medicaid. Medicaid started in our country in 1965. It's had a lot of iterations since that time. And in 2010, with Obamacare coming in, it says we are going to expand Medicaid starting in 2014, and every citizen in America is going to have access to basic health care. That's what the issue is that's hitting us the 1st of January. And Obamacare says we're going to have these health care insurance programs, exchanges in each state. Well, we've got that debate going on in Tallahassee right now, because if you look at Florida, we're due to expand our Medicaid by 1.1 to 1.3 million people. The government says we're going to send you $51 billion in the next 10 years to take care of that. You've got to set up your own health care exchange, or we'll come in and do it for you. That's the debate in Tallahassee. The House with Weatherford said, we don't want your money. We're spending $340 million a year right now, and we're taking care of 500,000 people. Over in the Senate, they're saying, no, we want to incorporate this. We want your $51 billion, but we don't want to do it through Medicaid. We want to do what's called the Arkansas plan, and we want to buy health care insurance to do this. So that's the debate in Tallahassee. Now, is that going to get settled this week? Probably not. I don't think there's a lot of chance for that. But I am suggesting to you, if it isn't, they'll be back. God will call them back to a special session, because if you think that we're going to turn down $51 billion to solve our Medicaid problem, I would suggest that's inaccurate. What'll happen with it? We'll see the two people, the head of the Senate and the head of the House, they'll get together and say, look, we got to solve this. And they'll come to some conclusions after the whole system is settled down, and they come back to a special session, and they'll solve this. I would suggest it'll look more like the Senate version than it will the House, because if we go the House way, you still got 600 to 700,000 people. The federal government will come in and set up their own health care insurance exchange, and they will see that those services are purchased. That's the reality of it. That's where we're headed with that. Well, if you look at the plan and what's going to happen, and I'm saying the plan, I'm speaking what supposedly is the plan in Manatee County. One of the first things we've got to do is look at the financial situation. I think Cliff did a very good job of relating. We sold our hospital in 1984, and when we sold it, we put that $44.3 million in a trust, plus a $20 million promissory note. Over the years, Chip Shore has done a wonderful job of managing that, and he got that fund up to over $60 million, while at the same time meeting the healthcare needs. As we got into 2007 and 2008, the cost of that care started to exceed the amount of earnings it was. Our leaders had a choice to make. Do we go to the public and ask for some taxes, or do we start to spend this about $50 million at the time? They chose to spend the $50 million. We will harvest that decision late in 2015. So this isn't a crisis. This is a planned depletion. This is a planned bankruptcy of the money we got, which was actually almost $80 million all told. And we will harvest that in late 2015. So all of a sudden, in 2010, we have the crisis, and we get an alliance, and we go forward to studying it. I would suggest we haven't even begun to study it adequately. What is our real option here? Are we got a $9 million problem? Have we got a $25 million problem? If you look at the budget for Manatee County, we're spending $87 million on our health care spend. Isn't that our true problem? If you look at Medicaid, and Medicare, and Obamacare at the present time, these are laws. We've got it. And this is the law that says this is a tax. You're paying tax right now for Obamacare. And you say, well, let's tax ourselves again. Isn't that double taxation? I think it is. It looks like double taxation to me. I say what we have to do is we've got to come back and solve this the Manatee way. We've got to study our options. We've got to look and see what's constructive for our community, and we've got to put our collective shoulder to the task. Right now, what we're doing is we're creating battle lines. As closely as I can tell, these battle lines create battle wounds, and battle wounds create battle scars. And after this goes and the people vote it down, we've got to come back and we've got to heal those battle scars, and we still have to deal with the issue. We have initiatives, we have solutions, we have best practices in this country right now concerning health care, and we can put our collective shoulders to the effort and we can solve it. We can solve it the Manatee way. We can't solve it with a win-lose situation. That only gets us into more battle scars. So my kind of conclusion is we're going to settle this and we're going to solve it. But we're going to solve it the Manatee way. And we're not going to worry about, do we have a crisis? We don't have a crisis. We have a challenge. And we have a challenge we've got to meet, because I would suggest in 2008, a decision was made that was not a good decision. So let's come together. Let's talk about how we solve it. Let's study our options. And let's get this problem under hand. Thank you.
I congratulate our speakers. Everyone came in under the deadline. The bell never rang. So that is amazing. They're really getting good. I think we've got them trained. So I've got to cancel this now so it doesn't ring on me. So it's time for questions and answers, and the routine is that you come up to the microphone. Anybody that wants to start can come up. Remember, let me talk about the ground rules here again one last time. And before we start the questions and answers, because I'll forget this at the end, I want to express our undying gratitude to METV for their consistent effort to cover Tiger Bay. But, and here's something great. This is an important thing that's happening in our county, and Charles tells me it will be on television tonight. So you were here today. If you want to see yourself on TV, just flip on the TV tonight. So thank you, Charles. Mary.
I'm Mary Ruiz. I am a Tiger Bay member, and my question is, What's going to happen if the half-penny sales tax doesn't pass?
Did you have anybody in mind to answer that?
One of the things we got to be careful of, Mary, if we talk about it long enough, we'll solve it here at this meeting today. Because the fact of the matter is we have our leadership for the community, and it's here right now. What's going to happen when we come back to talk about it next? What's going to happen is we're, number one, going to talk about what is our true problem. Our true problem is an $87 million issue that we're now spending. You let Obamacare really get clicking. 3 to 5 years from now, we've got $125 million to $150 million problem, I'll promise you. And the way we're going to solve this is we're going to look at initiatives, because right now there's a huge paradigm shift in the way health care is provided, and we're going to be talking about what is it and how are we going to practice medicine and how we're going to pay for that. And the thing that is exciting to me is Manatee County has every opportunity to be a model community in America today. That's the kind of leadership we have here, but also that's the kind of opportunity because we've done things so right. We're going to solve this by coming together. And you say specifically what is that plan? Specifically, that plan is going to be through the discussion. We're going to, number one, adequately identify this. We're going to adequately identify our options. We're going to adequately identify what can we do to do this, and then we're going to do it, because that's the Manatee way, and that's the way we do it.
Dr. Clulo? Yeah.
I know we'll solve it, but the question was that what's going to happen if we don't have the money, and I suspect that we will have an increase in property taxes to help fund that money that we're losing already, or we will have cut in hospital services or physician providers cutting services to patients.
Yes.
Hi, my name's Steve Vernon. I'm a new member, just joined.
Oh, okay. Welcome.
Thank you very much. I have a question. Actually, I was writing down a number of things, and I have a question, one for each gentleman. Is that okay?
Of course.
All right. For Dr. Kennard, you had a lot of good ideas. I've seen articles that you've written, and I'd like to know, would you sit on a committee to implement your plans? Because I think it's going to be needed after the election.
All right. We'll answer it briefly, one at a time here.
Mr. Vernon, that's what I have tried to do is give an overview and a perspective that says there is in my opinion, a better way to do it. If you get me into too deep of a dive, it's going to get personal, and I don't want to do that. But as it's projected right now, I would not participate in that. I'm at an age where I'm having a lot of fun working with the school district and doing some other initiatives, and I really only want to do win-win. And I'm not going to be a part of an initiative in our county that's going to be a win-lose. So I guess a quick answer would be no, I won't.
All right, thank you.
All right. Next person.
Yes.
Next question.
Next person, the question is in regards to the charges for the hospital. So I guess Dr. Clulo could address that. The question is, the hospitals have been claiming that they lose a lot of money in providing indigent health care. But on what basis do they actually calculate that? Is it on the charges, or is it on the Medicare allowable amount?
Well, I would probably be the wrong person to be asking. You'd probably have to ask a hospital administrator that question. I don't know if we have anybody in the room regarding that.
Could you answer that? Yeah, well, that's a hospital. Yeah. I'm going to let Mary answer that question because she is a hospital administrator and she's.
Well, at Manatee Glens, we're not for profit, so we have accounting rules we have to follow, and we have to state charity care in terms of actual cash out the door cost. And last year, our fiscal year ends June 30th, 2012, we provided $16.4 million in charity care. The hospitals calculate their cost based on. I'm not sure about the med-surg hospitals, but I do know when they submit their cost to the county, it's based on Medicare rates.
All right, thank you. Dick says he can answer.
I'll take a shot at that. I created a hospital. It's called Blake. And the fact of the matter is, what we're hearing is how much they're losing from charges. If you take what actual costs are, it's a very different picture than that. And a lot of times the third-party administrators are negotiating discounts. I'll tell you a little secret, discounts don't make a hoot of difference. If you look at where we're headed today, we're headed that we're going to go buy our health care in hospitals on case base, and that's going to be coming sooner more than later. And that'll be based on cost plus a certain yield.
Okay, I hope that was helpful.
It was.
Good. And the
Yes.
third question?
For Mr. Walters. The question is, you read the ballot, and in the ballot, it says absolutely nothing, not one word about reducing property taxes. Yet, a lot of people speak, especially the proponents of the referendum, about this is a reduction of property taxes.
Cliff can talk to that.
Yeah, thanks.
That is a legal question.
Not only it's a legal question as much as it is a community question. The county commission has announced that there would be a dollar-for-dollar offset. If they fail in that promise that they have made, then the ballot box is where you rectify that circumstance. I know we all can criticize our elected leadership. I'm not immune to that. The reality is almost all of the people that serve an elected office in this community are trying very hard to do the right thing as they perceive it. And if they say to us, the voters, that they're going to do a dollar-for-dollar offset, I have confidence that they will do it. And if they don't do it, I'm prepared to lead the charge to show that there's consequences for that. But they have done this before. When they built the jail, it was a 4-year sales tax that they imposed upon the community. And they said, but if we get it paid off early, we will stop the sales tax. And they did it, I think it was after 3 years of the 4 years. So there is a history of this, of our politicians actually doing what they would say. I know it's sometimes we make fun of people because they're right here in front of us, and sometimes they deserve some of the arrows they take. But I have great confidence in our leadership in this community, and on a personal level, I'm comfortable with that promise.
Well, I have spoken to each commissioner. There is no promise, no firm commitment, no guarantee that they will reduce property taxes. And since many of them are here, if that's in dispute, they can make a comment.
I think they should.
All right. Thank you.
Thank you. Okay, Rusty.
I'm Rusty Russell. I am a member, and I'd like to say that I am a very strong Republican, a moderate Republican. But last night, it just absolutely astounded me. I answered the telephone, and the gentleman said, I am so-and-so, and I'm calling from Republican headquarters, and I want to urge you not to vote or to vote no on the sales tax. And I lectured him. But I don't think it did a bit of good.
As only you can.
But first of all, I don't think that either the Democrat or Republican Party should be speaking up or against this. This is not a political thing. It is a community thing. And nextly, that's all. I'll just quit there.
Okay, that was not a question, but we'll let you get away with it. Jackie.
Thank you. My name is Jackie Dzelski, and I am a member of Tiger Bay. We've heard a lot of numbers, and I agree with Cliff that depending on who you talk to, there can be variances there in the numbers that we talk about. But I believe that there will be a responsibility of Manatee County to fund some level of health care for those that can't afford to fund it themselves. So to me, the question boils down to, is it more equitable to pay for whatever we decide to pay for with a property tax or with a sales tax? And so I'd like to hear from our speakers as to what they feel is more equitable.
Okay. We'll start with you, Scott.
It's just a matter of opinion, but I would think that the sales tax would be more equitable. When you're looking at where the funds are coming from, or who's utilizing the healthcare trust fund, you have those that are utilizing who are underinsured or uninsured, so they would be funding some of that by paying a sales tax. They also would have the tourists or visitors to our county. They would be paying a certain percentage of that sales tax. Some sources say up to as much as 30%. And then, of course, you have the property tax owner who will be paying some of that, but that will be reduced by having those other sources help fund the tax.
Yeah. She said everybody.
Jackie, that's an excellent question, because what you're really saying is, how do we solve it? The first thing that I'm saying is, let's identify the problem. Let's know what our need is for this thing, because there's so much confusion on it right now that I'm even confused. I got a document yesterday that says of the $23 million, we're going to spend $9 million for indigent care, and then we're going to apparently spend $14 million to pay down taxes. And yet our referendum says we're going to spend all this money for indigent health care. I don't think we've identified adequately what our challenge is. We've got an $87 million challenge in Manatee County as we sit here today. That's the challenge that we need to say. Do we need a half cent? Maybe we need a full cent. I don't know. Am I opposed to having a taxation for that way? I was one of the greatest champions when we did a half-cent sales tax for capital formation for our school district, and I'm not a bit opposed to a sales tax. I'm saying let's identify what we need, how we're going to do it, and let's come together and get a solution that's going to be meaningful and enduring.
You know, we're really talking about two problems, and boy, do they collide. One is, what should the plan be for helping and take care of the indigents? And the other is, how do you pay for it? And when we get in this debate, boy, it just goes back and forth. Jackie's question gets into, what is the best way to pay for it, whatever it is? Well, right now, we're paying $24 million for it. Now, if you think we're paying too much, I guess you should be talking to the politicians about, why are we doing crisis intervention, rape counseling, why are we taking care of prisoners, and all that. You can have that debate, or are they doing it efficiently? But to me, when you get into how do we pay for it, the property tax burden in Florida is very high. There have been numerous initiatives over the past decade and a half trying to reduce it. All of our surrounding counties, when they were faced with this issue, they went and elected to go with the sales tax solution. They felt using a third of the visitors to pay for it. After all, I bet not all the prisoners in Manatee County are residents by choice. They probably came, many of them elsewhere. Well, let them help pay for that while they're getting teed up. So to me, on balance, it does make sense to use a sales tax to cover whatever it is that we as a community feel needs to be covered.
Okay. Yes, come on. Make sure you're talking. Yeah, that's good.
Patty Benson, member, chair of the Democratic Party, and I heard about the Republican forwardization, and it has nothing to do with political party. It happens to be, so here I go again. It happens to be about people, and we need to support these people who don't have the care we have. And Dr. Conrad, you meant you said Conard. Why do you think this proposition is a win-lose? I didn't understand that comment you made.
Brief.
This is a win-lose because we have such a strong feeling in this community that it's right or it's wrong. And the fact of the matter is, it's a challenge that we have to come together, and we've got to think it through And we haven't done enough vetting of it. Whether it's true or not, there's a perception in this community that there's not enough transparency and there's not enough accountability on this issue. And we've got to clarify all those things. And I come back to the point that we've got to decide what is it we're trying to solve. I don't think we're trying to solve a $9 million issue. I think we're looking at an $87 million issue that within 3 to 5 years is a $125 million issue if we don't deal with that effectively. My experience is we deal with things effectively when we come together, we put our shoulders to the task, and then we solve it.
Okay.
Hi, my name's Steve Wilson. I'm a member. There's a question I suspect for you, Cliff. I'm inclined to be in favor of this tax, but I'm really puzzled as to why we're having this referendum at a very strange time when you're going to have a very small turnout. Now, I know you had nothing to do with the decision, but maybe you could explain the why and the wherefore we're doing this election now, or this referendum now, rather than as part of the general election process.
Steve, I wasn't part of the decision making, so I'm not really familiar with it. I would suggest that the people involved are trying to prepare the budgets for the forthcoming years, and statutorily there's requirements that you have to have your budgets in essence locked in by June or early July in order to plan for the forthcoming year. The county is trying to now do 2-year budgeting ahead in order to more effectively manage the resources, and it's a complexity if you wait and you lose a whole year cycle and then find ourselves in the crisis that we don't have now but we hope to avoid. But I'm speculating it would take someone that was actually in those discussions that could help us with that.
That needs a little clarification. That begs the question, Steve, that I'd like to try to do. If we have this crisis on a 2-year cycle, why didn't we deal effectively with this in 2008? We have 31 years from the time we sold our hospital and were prudent with putting our money in a trust to where we bankrupted. Why didn't we deal with that in 2008? And that's part of the same issue that I say we need to study it. We need more transparency and we need more accountability.
I'm going to ask all of our speakers, if you've already made a point, we got it. We don't need to hear it again and again. Okay.
I'm Tom Nolan. I'm a member of Tiger Bay. Dick, this question is for you. Where did $87 million come from? Because it is clear in the county budget that $9 million of it is coming from the Healthcare Trust Fund, 14 comes from property taxes, and that's what we're paying as far as I know. So because a few minutes ago you threw Medicare in this, and Medicare has nothing to do with that.
Thank you. I'll be happy to try to deal with that. Let's deal with the $9 million issue as a part of that, Tom, if we could. $6,925,000 goes to Manatee Memorial and Lakewood Ranch. $1,091,085 this year goes to Blake. $1 million goes to the physicians. That's $9,016,085. That's your $9 million piece. If you look at the budget that was put out by the county, they're looking at a total of $25,569,938 for medical service totals, and that's what Cliff was relating to. They're looking also at $39,070,493 for their own health services for the employees on the self-insured situation. They're looking at $4.1 million in the budget for their Medicaid backlog, and they're looking at $18,419,579 that they're putting in for public safety emergency medical services. That, if I'm not mistaken, is $87,160,010, Tom.
Okay, I think I need to point out, though, that the referendum specifically refers only to the trust fund and not to the county employees and other things. I mean, we have to stick with the facts. Yes.
My name is Cliff Curley. I, too, am a new member.
Welcome, Cliff.
my first meeting. I don't know who, if anyone, can address this matter, but the bill, or the tax as proposed, has a 10-year sunset. A, why was it a 10-year sunset? Is everyone going to be cured and there will be no indigent care at the end of 10 years? Or will we just have another go-round on something else that will be an adjustment for not thinking through this process? I know I'm not supposed to speak, but I agree with Dr. Conrad. Excuse me. I can't see. I have glasses. The train is on the track, it looks like, and there's going to be no turning back. The election's in 6 weeks or so, and if it passes, that train is going to just continue. I don't know how you pull that train back, but I do agree. This is on too fast of a track for me, and I've taken the high-speed rail in Europe.
We don't do speeches, we do questions.
Again, because I wasn't at the table when they came up with the 10 years, I'm speculating, perhaps with some degree of comfort, that we have a history in this county of passing sales tax initiatives for schools and for other infrastructure needs of the community. But under the guise of trust but verify, but we like to put a cap on it. If they want to renew it, we have to have validation that the money is being spent appropriately as promised. The voters ought to have another chance to reaffirm that what the voters did 10 years ago is still the need in the community. And there's a way that sometimes taxes become legacies for things that are no longer as an imperative to the community. So I think it is up to those that are administering the revenue for, assuming the sales tax initiative passes, to continue to communicate with the community, provide the transparency that should go with it, and if they fail to do so, they will pay the price ultimately if they can't get it renewed in 10 years.
Okay.
Good afternoon. My name is Nancy O'Toole, and I'm a member of Tiger Bay. And I'm going to direct this question to Scott. I apologize. I can't say your last name, and I couldn't remember. What is it?
Clulo.
Thank you, and I apologize. When the poor do not have medical access, where are they going to go for their care?
You're talking about currently, or?
Asked.
Well, majority of people who are under or are uninsured go to the emergency rooms currently.
And will the hospital continue to take them?
That I can't answer for you. You'd have to ask the hospital. You're talking about someone's going to go, with the EMTALA, which is the law that requires you to take care of them. Mm-hmm. They're going to have to be taken care of them. Who's going to pay for it is really what the question is. Who's going to pay for it? They still have to be taken care of. If you go to the emergency room, you have no insurance, they're going to take care of you.
Okay.
So, and who's going to pay for it? It usually ends up going to be the property tax owner. The patient, if they're underinsured, isn't going to pay.
Okay.
So.
Thank you.
And I just want to make a comment regarding the healthcare trust fund, and I heard some bailing around of we're going to run out of this trust fund, and if we all know people who are retired, and we had interest rate reductions a number of years ago with the recession, and we lost interest income. Part of that money in that healthcare trust fund was also invaded to help pay for those people who are underinsured or uninsured, because that interest income was reduced as well. I just want to make that known. People need to understand that it wasn't necessarily spent inappropriately. We didn't have the interest that was going to be utilized to pay for those patients because of the recession.
I wanted to add 2 points of clarification. I was at the county commission meeting as in the audience. I'm not a part of the decision-making team, but I was in the audience at the time they decided on the 10-year. And Cliff's analysis is correct. It's a self-governing way of saying, we may not need it. Healthcare may have changed. Other things may have happened. We can't really have a sales tax go on forever. We want to take a look at it. So it's kind of in the tradition of sunset. Is that a fair statement, Betsy, do you think? Okay. Yeah, well, she did, but and the second point of clarification is that although the law demands that hospitals do not turn people away who are in need of an emergency, in an emergency situation. The law does not insist that the emergency room do things like schedule surgery that is elective or necessary right this moment and so on. The law just says if a person's on your doorstep and they're bleeding, you've got to stop the bleeding. If they've got a broken arm, you've got to set it. If they're in a diabetic coma, you've got to bring them out of it. But they don't get preventive care. They don't give long-term care. So, and emergency room care is the most expensive care delivered in our country. So but that's a confusion that many people have, is to say, oh well, they so big deal, they go to the emergency room. What question are you answering? Making 2 points of clarification. Yeah, 2 points. I'm not answering a question. I don't do that. I'm just clarifying something. Any other questions? Jonathan.
Jonathan Fleece, corporate member, Blaylock Walters Law Firm. This is for Dr. Connard. Dr. Connard, you gave us the history of the Red Card program, which I know is legendary in this community. And the question really boils down to what I see the issue being, which is the $9 million shortfall that's going to occur sometime in the 2015 budget year if we don't have a supplement for that $9 million, either through property taxes or sales taxes. So the question is, if the sales tax referendum fails, what ideas do you have with the Red Card program to basically sit down with Kevin DeLallo, CEO of Manatee Memorial Hospital, Dan Frederick, CEO of Blake Hospital, and all the physicians in our community that are going to have to accept the new Red Card program that you implemented many years ago to either provide that care for $9 million for free or stop providing the care. So how would we solve that deficit if the sales tax initiative fails?
That's an excellent question, and let me also point out my admiration for all the leadership you've given at this point on it. Then what'll happen is, let me assure you one thing right now, there's more free health care given in Manatee County every day than is ever paid for. Let me assure you of that. It happens. I was speaking to a physician yesterday who hasn't increased his fees since 1994, and he still gets the call of urgency, and he gives the services, and he gives them for free. What's going to happen when this fails? We're going to come back to the table. We're going to adequately define what problem we're trying to solve. We're going to work together to do that. And do we do a sales tax? Possibly we do a sales tax. Do we have time to do that? We've got time to do that. But the time we do it is after we've got clarification for about that $51 billion that's coming to the state of Florida, because I assure you tens of millions of that will come to Manatee County.
Carol, this is going to be the last question. Carol.
I've been a nurse since 1977, and I work with Dr. Connard, and the last time he practiced medicine, I think, was around 30 years ago. My husband is a current practitioner, and I brought this up. I'm not talking about whether I support it or not. When I want to tell you what's going on in the medical world, my husband had a patient that could not be seen by a doctor, went to the emergency rooms. They said, you need to see a doctor. All you need to do is see a dermatologist. I've showed the photos at the commission meetings. He had to have his eyelid removed and his nose removed. Now, and my husband's done about 8 surgeries since on him. So the clear fact is, I wish we could find doctors that would do this for nothing, but they won't. So my question, I'm making a comment, I'm answering what you're saying. Dr. Clulo, who actually works in the world now, do you know of doctors that would do this for nothing, for a red card system? Or do you think the medical community would do this for zero?
Well, we already do. I mean, on a regular basis, it would be unable to be sustainable. You know, you're running a business, you have to be able to pay your bills too. But majority of us already do. I see patients all the time in my office who had insurance, they lost their jobs in the recent recession. I still see them, I still take care of them. Either I reduce their fee or I say, you know, no bill today. And those patients appreciate it, and hopefully they'll find a job and they'll get insurance again, they appreciate that when you take care of them. That's what we're supposed to do as physicians. It's the same with, with We Care. We Care was an organization that was formed by the physicians of Manatee County Medical Society, and they all we have a large volunteer of specialists in primary care to help serve those patients who are underinsured or uninsured. Actually uninsured, not the underinsured. But we in this community, you'll find physicians, you can ask any physician, all of them have given some kind of care to a patient who needed care and didn't care what their ability to pay was.
That needs clarification.
Go ahead.
Yeah.
Quickly.
Thank you, Carol, for pointing out that I retired 30 years ago. I appreciate that because I wish that meant I could quit practicing medicine. I'm leaving this meeting to go up to Moffitt, where one of my patients is having cancer therapy for a third-degree melanoma or stage 3 melanoma, and I need to get up there as soon as I can when this is over with. And as far as do I practice, not actively. I don't have an active practice. I don't think I've ever quit administering health care in Manatee County.
Okay. Well, I hope this has been helpful to you. I hope it has been enlightening. I appreciate everyone coming. It's been a great meeting. Thank you very much. Thank you very much to our 3 speakers. We really appreciate it. And have a great day.